Biomedical science is an exciting and dynamic area that seeks to understand and diagnose human diseases. 70% of all decisions regarding a patient's diagnosis and treatment are based on results of tests biomedical scientists perform. Let's meet some of the team that work in the pathology labs here at Jersey General Hospital.
In bacteriology and virology, we test about 2,600 samples a week from the entire hospital and island. We're in the lab every single day of the year, and our job is to diagnose our patients' infections. We also tell the doctors which antibiotics will work. Unlike other departments that mainly look at blood, we test different samples such as feces, urine, tissues and wound swabs, as well as blood. We look for bacteria, viruses, yeasts and parasites.
As infection and outbreak detectives, we love what we do. We do this using microscopes, incubators for culture, along with biochemical and molecular tests. We have one main analyzer that detects blood-borne viruses and screens blood donations. We also provide fertility services helping people with assisted reproduction. And since the COVID outbreak began, we processed over 188,000 COVID samples and thousands of other tests.
In blood transfusion, we are often referred to as the vampires of pathology, but we help to save lives. When there is a trauma or hemorrhage event, we act quickly and calmly to provide safe and compatible blood products, such as red cells, plasma products and platelets. We are the only transfusion department in Jersey. This means we must provide services to fit the needs of all islanders. Sometimes we have very complex cases, so have specialist serology skills to perform blood grouping, antibody screening, antibody identification and titration, which many mainland hospitals would refer to a specialist centre for investigation. We also ensure blood is safe to transfuse by testing our donor red cells against the patient plasma and confirming that there is no reaction. We are unique in having our own donor service on site too. We are able to follow the whole processing of collecting, manufacturing, testing and issuing red blood cell donations to patients. We are also involved in Jersey's haemophilia service by providing patients with therapeutic products which will help with their clotting and make their lives a little easier.
In hematology, we provide a 24-hour service that plays a major role in the diagnosis and monitoring of patients with disorders in the blood and bone marrow. We process approximately 170,000 samples per year. For this, we use complex analyzers and microscopes to count and identify different types of cells in the blood. This enables us to diagnose and monitor the treatment of diseases such as anemia, leukemia, and associated blood cancers. We also examine blood under the microscope to identify and classify different types of tropical disease parasites, such as malaria and sleeping sickness. The other major part of our work is the testing of patients' blood plasma to identify and treat diseases that cause bleeding or clotting abnormalities, such as haemophilia and thrombosis.
We also have a clinical chemistry department where we analyse blood and other bodily fluids to help in the diagnosis of diseases. 2.8 million tests a year are processed here in our laboratory in Jersey. The biochemistry laboratory is responsible for performing a range of analytical tests, including renal, cardiac, liver and bone assessment. Other common tests we undertake are used in the investigation of infertility, cancers, diabetes, cardiovascular disease and drug monitoring, as well as antenatal screening for congenital abnormalities. In addition, our multidisciplinary team provides a full out-of-hours critical service covering all departments as a lone worker. This ensures rapid response to emergency situations throughout the night, using their own initiative to deal with situations under pressure.
In the cellular pathology team, we study tissue and fluid samples. These can be taken during surgery or at post-mortem to detect and diagnose disease progression, and to see if there are any features which may indicate response to specific treatments by looking for abnormal features in tissue and cells. On average, we receive 13,000 tissue samples each year. This equates to roughly 105,000 separate tissue sections being cut and placed on a slide. These mounted tissue sections are stained using specialist techniques, which allows for the morphology of the cells to be seen down a microscope. These slides are screened by a pathologist. Fluid samples such as sputum and urine are also processed by the cellular pathology team. For these sample types, cells are adhered directly onto glass slides and stained using specialist techniques. These sample types are taken to help confirm or exclude the presence of disease.
Working within pathology is exceptionally rewarding. It is science at the heart of healthcare. If you have an interest in science, then this could be the perfect career choice for you. With advancements in technology and testing requirements, it is an ever-evolving specialism. As a biomedical scientist, other interests can also be supported, including quality, training, and IT. If you wish to go on and study biomedical science, it's important to select a degree course that is accredited through the Institute of Biomedical Science. But please do contact the pathology team if you need any further information or guidance on biomedical science as a career option. We'd love to hear from you.